Idecabtagene Vicleucel is a medication used for a specific type of cancer called multiple myeloma. It is a form of gene therapy made from your own white blood cells, and it is given only to you. These white blood cells have been altered to have a special protein that helps your body slow down or stop the growth of certain cancer cells. This medication is used when other treatments have not worked or when the cancer has come back. It is important to follow the prescribed dosage and timing for the best results. Before starting treatment with Idecabtagene Vicleucel, make sure to read the medication guide provided by your healthcare professional. If you have any questions, don't hesitate to ask. Your doctor will administer 3 days of chemotherapy before starting treatment with this product to help prepare your body. This product is given through a slow injection into a vein as directed by your doctor. You may receive one or more injections, one after another, each taking about 30 minutes. To reduce the risk of side effects, your doctor may also give you other medications such as acetaminophen and diphenhydramine before the injection of Idecabtagene Vicleucel. After your treatment, your doctor will monitor you daily for at least 7 days to assess the effectiveness of the treatment and help you manage any side effects. It is recommended to stay near the treatment location for at least 4 weeks, for example, within a 2-hour drive. Some common side effects of Idecabtagene Vicleucel include nausea, constipation, headache, tiredness, trouble sleeping, or loss of appetite. If any of these effects persist or worsen, it's important to let your doctor or pharmacist know. Although there is a risk of serious side effects, your doctor has prescribed this medication because they believe the benefits outweigh the risks. Your doctor will monitor you closely to decrease your risk of serious side effects. Contact your doctor immediately if you experience any serious side effects such as fast or irregular heartbeat, muscle or joint pain, or swelling. There is also a rare risk of developing other cancers, so be sure to tell your doctor if you develop swollen glands or unusual growths or lumps. While serious allergic reactions to this medication are rare, seek medical help right away if you experience symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. And if you experience any side effects, you can report them to the FDA in the US or Health Canada in Canada. Before starting treatment with Idecabtagene Vicleucel, it's important to be aware of the potential serious reactions it may cause, such as cytokine release syndrome and hemophagocytic lymphohistiocytosis. Monitoring and prompt treatment can help decrease the risk of these reactions. It's crucial to inform your doctor of your medical history, especially if you have had any recent infections. If you experience symptoms such as high fever, trouble breathing, severe nausea, or signs of kidney problems, it's important to seek medical attention right away. Additionally, Idecabtagene Vicleucel can lead to serious nerve problems, so it's important to notify your doctor if you experience drowsiness, seizures, or mental/mood changes. This medication may also cause a severe decrease in blood cells, increasing the risk of infections and anemia/bleeding problems. If you notice signs of infection, unusual bruising/bleeding, or unusual tiredness, it's important to contact your doctor. It's important to note that before receiving this medication, all doctors, pharmacists, and patients must adhere to the requirements of the Abecma REMS program, which is in place to ensure safe use of the medication. If you're considering this medication in a country other than the United States, it's essential to consult your doctor and pharmacist for your country's regulations. Before starting treatment with Idecabtagene Vicleucel, it's important to let your doctor know about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your pharmacist as well. It's also crucial to inform your doctor about your medical history, especially if you have had heart, kidney, liver, lung, or breathing problems, nerve issues, or any past, current, or recent infections. This medication can increase your risk of getting infections or make existing infections worse, so it's important to avoid contact with anyone who has a contagious illness. If you have been exposed to an infection, it's important to speak to your doctor for further guidance. Additionally, it's important to inform your healthcare professional if you are using Idecabtagene Vicleucel before receiving any immunizations or vaccinations. It's also recommended to avoid contact with individuals who have recently received live vaccines. Furthermore, it's important to exercise caution with sharp objects and avoid activities that could result in injury, as this medication may increase your risk of bleeding. It may also cause drowsiness, dizziness, and affect coordination and cognitive function. It's recommended to refrain from driving, using machinery, or engaging in activities that require alertness for at least 8 weeks after treatment. Limiting alcohol consumption is also advisable, and it's important to discuss the use of marijuana with your doctor. If you are planning to have surgery, it's important to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, over-the-counter medications, and herbal products. Additionally, it's crucial to discuss pregnancy and breastfeeding with your doctor before starting this medication. This product may pose risks to an unborn baby, so a pregnancy test may be ordered before starting treatment. It's important to speak to your doctor immediately if you become pregnant while using this product, and it's also recommended to consult your doctor before breastfeeding while using this medication. It's important to be aware of potential drug interactions that could affect how your medications work or increase the risk of serious side effects. Keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. It's also important to note that this medication may interfere with certain lab tests, such as some HIV tests, which could potentially cause false test results. Make sure to inform lab personnel and all your doctors that you are using this drug. If you or someone you know has taken too much Idecabtagene Vicleucel and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. You can call 911 if it's an emergency, or contact your local poison control center for assistance. In the U.S., you can reach the Poison Control Center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's crucial to act quickly in these situations to ensure proper care and treatment. Before receiving Idecabtagene Vicleucel, your doctor may need to perform certain medical tests to ensure it is safe for you. It is important to attend all scheduled medical appointments and follow your doctor's instructions. After receiving this treatment, it is important not to donate blood, organs, tissues, or cells. This is to prevent any potential harm to the recipient. Idecabtagene Vicleucel 300x10 exp 6-460 cell 4 suspension is used to treat certain types of non-Hodgkin lymphoma. This medication works by helping the immune system to recognize and attack abnormal cancer cells. It is given as a one-time infusion, and the dosage depends on the patient's body weight. The infusion process can take several hours, so it's important to plan for a day at the hospital or infusion center. It's important to follow the healthcare provider's instructions for pre-medications and monitoring after the infusion. The timing of this medication is crucial, and the healthcare provider will determine the best time for the infusion based on the patient's condition and schedule. This medication is not available for home use and can only be administered in a hospital or clinic setting. It should not be stored at home. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.